One of the most common musculoskeletal conditions is low back pain. Lots of people get low back pain. There are many causes to low back pain. The most obvious one being lifting a heavy object and you strain the muscles in the back. And often more than that happens. You can have vertebrae go out of alignment, the pelvis can get torqued, you can have inflammation in the discs, etc. So the way I approach those people is, again, very eclectic to do a combination of therapies. I find this works much better than any one technique like chiropractic adjusting alone. Chiropractic adjusting of the spine is absolutely fantastic and necessary, but also doing techniques that really help the soft tissues, such as myofascial release, where you stretch out the muscles and rebalance them. Now, there are other causes of low back pain that people are not aware of, one of which is the digestive tract, believe it or not. When the bowels are unhappy, let's say they're a little bit crampy, gassy, bloaty, constipation is there, or anything like that, even when it's very subtle and not really a major health concern, still can actually lead to a back going out, so to speak. It can tighten the muscles, and once the muscles get a little tight, then you can do a little thing like pick up a sock and your back goes out because the back goes into spasm. And again, you can have inflammation of the discs and vertebrae going out of alignment, etc. Another causative factor is stress. The kidneys and adrenal glands are right in your low back on either side of the spine, and they respond to stress. Any kind of worry and hurry can cause the muscles of the low back to tighten up, and again, it leads from one thing to another. The muscles tighten up, and then you do trivial things and strain those muscles, and then again, vertebrae go out of alignment, discs can get inflamed, etc. So, not only do I treat those conditions of the spine holistically with a combination of things such as myofascial massage techniques and vibration and the far infrared lamp, etc., etc. But I also treat those underlying conditions if they are there. For instance, helping people with their stress management, helping people realize the cause of their low back going out. If it was stress or if it is the bowels, finding a way to balance the bowels so that this doesn't happen again. And let's talk about other things such as the neck. The neck can go out for similar reasons. If you reach into an overhead compartment with your suitcase on the airplane, or if you are playing a sport or going to the gym for the first time in a long time, etc. These injuries to the neck, injuries to the low back, injuries to other parts of your body can happen when the body is not used to doing those activities, and then you engage in them and you get sprain and strain, etc. And so I'm going to explain now some of the techniques I do, such as myofascial release and cross fiber massage. So for instance, on a carpal tunnel syndrome, it's important to work on the forearm muscles. So myofascial release strips the muscle, so to speak, or massages along the long fibers of the muscle while you stretch the muscle, and then cross fiber comes across the tendons just around the area where they attach. These are absolutely invaluable techniques for treating something like carpal tunnel syndrome or knee injury, etc. So again, to go over some of the other reasons that could cause musculoskeletal conditions, you could have strain and stress. You can have vertebrae going out of alignment. You could have degeneration in the spine. That brings in other therapies. You could have a new injury or an old injury exacerbated by something you did recently. And again, digestive issues come into play. So this is a holistic and eclectic approach to treating musculoskeletal conditions.